Hello, I am Dr. Jay Hitson, Clinical Director of Blue Umbrella Medical Center in Murfreesboro, Tennessee. Our motto is Innovative, Integrated Health Solutions, and I'd like to talk to you a little bit about what that means. First of all, innovative. One of the things that is fascinating about the healthcare industry and the medical field in general is we are constantly making headway and new discoveries are being made. The problem is getting them implemented into normal, everyday healthcare systems. The reason why this gets a little bit muddied up is because of something we call the Goldilocks Principle. You can't be too big, you can't be too small, you have to be a just right size practice to be innovative. So, for instance, offices and practices that are too small, even though they're very agile, they don't have the resources to bring in a lot of these technologies and a lot of the innovations because they of lack of personnel, lack of funds, lack of ability to get all of the credentialing necessary to do those things. You also can't be too big because of bureaucracies. Too many people all sitting around a board table, all having to make the decision. I mean, you can't get 20 people to decide what they want for lunch, much less, how to implement these new innovative things. So being in that Goldilocks principle of just right size makes us very agile, very able to go with wherever it is that healthcare is going. Whenever new things are coming together, we're able to bring them in. So much easier than a lot of other practices could do. Now, integrated, that is extremely important to how we operate. So we are a medical facility that has multiple different specialties and credentials underneath of it. So we have medical doctors, we have nurses, we have physical therapists, we have registered dietitians, we have chiropractors, adding massage therapy, and we will add any other specialty that we need in order to get results for our patients. The reason this is important is because so many different diseases and conditions, and especially chronic things, they're not a one factor problem. So let me give you a great example. Neuropathy. We do a lot of work with neuropathy, which is a numbness, burning, tingling that usually is occurring in the hands or the feet mostly. Neuropathy is a lot of times caused by type 2 diabetes. Sometimes it's also caused by different nerve impingements. So even though we have this amazing treatment for neuropathy that gets really great results, if you don't address the root cause, which is the diabetes, then the symptoms are likely to come back. So having a diabetes program and using the medical technologies for that, along with the registered dietitian, bringing it all together under one roof, under one umbrella, we are able to get better results. And that's really what we love. That's all of the different providers. We love working together and being able to, it's wonderful to be able to compensate, for what one practitioner is certified to do, and the limitations and the scope of practice that another provider is able to step in and to do those things. It's been liberating as a provider, and frankly, most of us, we wouldn't have it any other way. And then lastly, it's health solutions. Innovative, integrated health solutions. We don't care nor are really all that interested in covering up the symptoms or managing the disease. We want to solve the problem, or at least reverse the progress, reverse the degenerative effects. So we don't really prescribe a whole lot of medication because most medications simply mask or manage the problems. We look for different modalities, different technologies, different treatment options that actually solve the problem, that actually go to the root cause and address it from there. It may sound like common sense, but it's just not done a whole lot in healthcare today. And we're really, really proud as a group and as a team that we're able to provide that kind of care and that kind of quality, and even better, those results for our patients. So that is us, Blue Umbrella Medical Center. We're in Murfreesboro, Tennessee. We love to help people. We work with chronic conditions. Acute conditions, so like recent falls, that kind of thing, the emergency departments, your urgent care centers, they've got that. They're fantastic. It's the chronic things. It's the arthritises. It's the neuropathies. It's the type 2 diabetes, the cardiovascular conditions. Obviously, we are always having to work with people on weight management because obesity leads to so many of these other things. Anxiety, depression. Just check us out on the website and you'll see just the plethora of things that we're able to do when you have an innovative, integrated team that is geared towards solutions. I am Dr. Jay Hitson with Blue Umbrella Medical Center.